Hi, I'm Dr. Adam Friedman, Professor and Chair of Dermatology here at GW. There's been a lot of discussions about the consequences of wearing a mask throughout the day, which of course we all need to keep doing, and is one of the greatest ways to prevent transmission of COVID-19 to ourselves and of course others. However, this comes at some cost. Certainly wearing a mask can cause friction and irritation on the skin, and of course throwing in some sweat, oil, that can also result in what we call irritant contact dermatitis, or red, itchy, and even painful skin. But an emerging trend is coming up, and that is what's called maskne, or the medical term is acne mechanica, or even cosmetica. Throughout history, we have documented acne that emerges due to outside influences, whether it be really thick makeup, or something that physically is occluding the skin, like for example, using a phone just on one side for too long. That occlusion can result in a backup of oil, the overgrowth of certain bacteria in the skin, and ultimately what we know as a big, nasty pimple. Same too with wearing a mask, that occlusion, but also that roughness, that rubbing, which can create inflammation, that is a double hit when it comes to causing what we call now maskne. There's some simple tips that could really help both prevent, but also manage this as it comes up. The same rules apply here as to when we try to limit the irritation of a face mask. That means using moisturizer to damp skin and doing this repeatedly throughout the day. Acne itself is a disease of barrier disruption, meaning that when you break out with pimples, your skin's ability to keep what are in and bad things out is also diminished. So applying a moisturizer to damp skin is even more important when you have acne breakouts. In terms of treating the breakouts themselves, there are a couple simple things you can do. First off, acne-based washes, those that contain benzoyl peroxide or salicylic acid, can help unroof those clogged pores, but also can be anti-inflammatory and antibacterial. The key is less is more. Both ingredients are quite irritating, so you want to use soaps that contain low concentrations of these ingredients. For benzoyl peroxide, I say less than 2.5%. For salicylic acid, 1% or below. From a treatment perspective, the best and first-line therapy for all acne are what are called topical retinoids. These are made from vitamin A, and there's one particular one that's available over the counter called adapalene. This comes in both gel and cream formulations. While it apparently is mild, being it's over the counter, it certainly can cause irritation like all of the prescription retinoids, so similar mantra, less is more. You're going to want to apply 1 dot to the entire face at bedtime to dry skin and not wet skin, because dry skin doesn't absorb things as well. We want to limit how much gets through. You want to do this every other day until your skin gets adjusted, because you probably will feel a little tight and dry in the morning. And then, once again, that moisturizer, facial moisturizer at that, oil-free, non-comedogenic, to damp skin multiple times a day. Now, if this do-it-yourself approach is not cutting it, you can certainly come see one of our great dermatologists here at GW to better assist your skincare needs.